But of course, now we're going to return you to that health briefing where the Health Minister, Dr. Joe Phaahla, is going to update the nation on government's response to monkeypox.
Our colleagues from the NICD, Dr. Michelle Kurum and Dr. Jacqueline Weyers, and good morning to members of the media and morning to all South Africans. We are meeting today almost 2 months after we lifted all the restrictions relating to COVID-19. But I'm also at the same time quite happy that we have nevertheless been keeping in touch with the public in terms of a number of developments in the health sector. This morning we'll focus on three matters. Firstly, the situation with the outbreak of monkeypox, and then we'll deal very briefly update in terms of where we are with the COVID-19 pandemic, and lastly, just some few highlights from a conference which some of us at a delegation of South Africa attended at the International AIDS Conference in Montreal, Canada. Regarding where we are with the monkeypox outbreak, on the 23rd of July 2022, the World Health Organization DG Dr. Tedros declared the current monkeypox outbreak as a public health emergency of international concern. Now, although monkeypox is less contagious than the smallpox and COVID-19, and all of us, smallpox has been eradicated in South Africa many years, almost 40 years ago, and many parts of the world. We're all familiar with the COVID pandemic, but the monkeypox causes less severe illness. The current rising numbers of positive cases has become a cause of concern, and therefore we cannot ignore it. I'm saying this because on Wednesday this week, on the 17th of August, we got a report from the NICD, NHLS, that we've had our fifth, number 5, positive case of monkeypox, which was a 28-year-old male from Johannesburg, Gauteng, with a travel history of Europe, Netherlands, and also it looks like it might have touched in Spain as well. The case was confirmed through a private laboratory, and samples were also sent to the NICD for sequencing. Now, this means that, as I said, we have recorded 5 positive cases between June 22 to the 17th of August, just 2 days ago. But there is no link at this stage, as the link has not been established with all these cases. But the team is still trying to check whether the last 2, the number 4 and 5, might have a link, because both had traveled to Europe, and it looks like to Spain, amongst other countries. We know that Spain has already recorded more than 5,000 positive cases and 2 deaths. Now, case 1 was recorded on the 22nd of June from a 30-year-old male residing in Johannesburg in the Gauteng province with no recent travel history, but who had presented with symptoms of monkeypox, and when tested, it was confirmed that it was monkeypox. The second case was recorded on the 28th of June from a 32-year-old male residing in the Western Cape province. Again, here there was no recent travel history, but presented with symptoms, and when the laboratory test was done, it was confirmed. Now, in as far as the third case is concerned, was recorded on the 10th of July from a 42-year-old male tourist from Switzerland visiting Limpopo province, also displaying the symptoms, and when the test was done, he was found to be positive. The tourist has recovered and has subsequently left for his home country. Now, the fourth case was recorded on the 14th of August from a 28-year-old male in the Western Cape. I've already referred to the similarity with the fifth case, who had recently traveled to Spain and presented with symptoms suggestive of monkeypox. The test confirmed positivity. Now, I need to mention that that's far. I've already mentioned about the tourist who has already returned back. All the three other cases have been mild and recovered, and also the fifth one, as far as we are aware at this stage, is very mild symptoms, but confirmed by laboratory. So, while the World Health Organization has not recommended any travel restrictions, but it is important that people who are traveling should exercise maximum caution. Now, in terms of there's a lot of questions just in terms of how the monkeypox is transmitted. It does involve person-to-person transmission, close contact, or infected materials from contaminated by an infected person. Although the data just shows that most of the cases have been some form of sexual contact, sexual partners, but it can transmit to anybody as a result of close contact with somebody who has been infected with the monkeypox virus. Now, in terms of the vaccination, there is currently no specific vaccine for monkeypox in our country. There are vaccines which have been confirmed in the world. There are three main vaccines worldwide for the prevention of monkeypox. Quite some complicated scientific names, but there are three of them. One branded as Imavec in Europe, and the third one is called LC16M8. Now, so these vaccines are available in the world, but at this stage, we don't have any of this registered in South Africa. So monkeypox is a similar virus to smallpox. And South Africa has stopped smallpox vaccinations around 1982. As I've said, smallpox was eradicated more than 40 years ago, when the global vaccination campaign came to an end due to successful eradication of smallpox. Since then, there have been no smallpox vaccines offered to the general population, and smallpox vaccines have not been included in our expanded program on immunization in South Africa. However, most people who are over 40 years of age probably would have some form of immunity from the earlier vaccination for smallpox. So, because of that, we hope that they will also have a form of immunity to monkeypox as well. Now, SAPRA has indicated in June this year that there are currently no smallpox or monkeypox vaccines registered in South Africa, and that we also don't have very specific registered antivirals for monkeypox. And they also indicated that they don't have any applications in as far as registration for monkeypox vaccination and antivirals in the country. Now, according to the report from the World Health Organization, there are currently a total of 28,000, just over 28,000 cases, with 11 deaths from the monkeypox. The scientists have advised that at the current moment, there is no need for mass vaccination because the situation remains under control. But what I need to indicate, therefore, is that while this is the case, we are monitoring the situation, working with our scientists, and we will be asking our Ministerial Advisory Committee on Vaccination also to weigh into this and advise us in terms of what the situation should be, monitoring together with the NICD, and at the appropriate time with the advice also from VMAC, from Vaccine Ministerial Advisory Committee, we will be able to, and of course also based on advice also from SABRA in terms of if any of the vaccines, are get registered in South Africa, remembering that for the vaccines and antivirals to be registered, a manufacturer or a pharmaceutical company would have to apply to SABRA for the registration. So those are that's the situation currently. It's not that we don't want to consider, the population at risk in terms of vaccination for monkeypox, but we're looking at all the facts. Firstly, that there must be one of the vaccines registered in South Africa, and secondly, also looking at the advice from WHO in terms of the population at risk. And so, as I've said, we will be depending also on the VMAC to give us advice. Just in terms of where we are currently with the COVID pandemic, I've mentioned in the beginning that we lifted all restrictions just around 2 months ago. I think 2 days from now will be full 2 months. Now, since we lifted the restrictions because infection numbers were very low, high levels of population immunity, and sustained decoupling of the infection rates, even when there was a small fifth wave, the decoupling between infection rates and severe illness continued, with very few people being admitted to hospital and even fewer needing ICU treatment. Now, since the lifting of the restrictions, the rate of testing, in other words, people presenting with symptoms for needing tests, cases, hospitalization, and also deaths have all continued to decline. Now, we believe this is an indication that we acted in the right public interest, because up to 2 months now, we have not seen any flare-up of COVID-19. Now, because currently the infection rates, as I said, is at a low rate, and we're shifting to a more endemic pattern, where we have also shifted our daily reporting to now weekly reporting, as we do with other respiratory illnesses such as influenza. In addition, we have stopped reporting on COVID-19 antigen testing because of poor data quality from antigen testing. This allows us more robust estimation of trends rather than when small daily numbers are followed, which are affected by small fluctuations. So but on a national level, I want to assure South Africans that we are continuing to monitor working with our National Institute of Communicable Diseases. The NSID is still continue on the surveillance and gives us surveillance reports. The ongoing monitoring of genomic data is also managed by our network of genomic surveillance, and this includes monitoring of the emergence of variants and lineages from tested patients and wastewater. Now, in the last few months, there have been some identification of some different variants, but what is comforting is that none of this have proven to be much of significance, and the pattern has not changed. So the two subvariants, which is a BA4 and BA5, are still the dominant ones in South Africa, as we see also from reports from various parts of the world that the BA4 and BA5 remain dominant. So at this stage, there hasn't been a variant of significance, of variant of concern, which in any part in South Africa and any part of the world. Some parts of the world have reported some indication of some severe illnesses as a result of the BA4 and BA5, but generally the pattern has remained the same in terms of high numbers, but reduced severity. As far as the vaccination is concerned, I just want to state again that vaccination has proven to be very effective. Even in our country, as we have indicated, even when the BA4 and BA5 have been flaring up in various parts of the country, it has proven beyond any doubt that with vaccination, most of the people have had very mild illnesses. And at this stage, I can also say that I'm one of those who can attest, because we did announce on the 19th July that I also tested positive, but it's very mild and only lasted for about 4 days. And as a result of that, one was able in the following week to be fully at work. The vaccination has been, struggling. On average, on a weekday, we see just around 11,000, 12,000, most of which are boosters. But we're very happy that there's still new takers of the vaccination. We would have still wished for a much more uptake because we still have the capacity. We know that some of the private vaccination sites have scaled down because of low uptake, but the public sector, vaccination sites are still, are now linked to our normal, health provision sites, our primary health centers, and also at hospitals. At the current moment, there hasn't been much movement in terms of doses administered, just over 37.3 million. We're pleased that our over 60 population has passed 70%. We remember that our aim was to cover 70% of the adult population. We're happy that the over 60s are standing at 71.4% of vaccination. Our vaccination ministerial advisory committee is now considering vaccination of children. Thus far, what they've recommended is that only children who are immunocompromised should be considered for vaccination, not those who are healthy. At this stage, it's not recommended that they should be vaccinated. So we are working on the logistics for this because there are a number of factors which needs to be put in place in order to make sure that the children between 5 and 11 can actually be vaccinated. Let me touch briefly again, just to emphasize that we want to again encourage South Africans to be vaccinated against COVID, because even though the infection rates are low, severity is low, we don't know what variants will be coming, and it has shown that even with variants, the vaccination is still very effective. Just very briefly on the adverse effects of vaccination. We reported through, and SAPRA did report that there is a confirmed case of a patient who succumbed to Guillain-Barré syndrome, which has been positively linked to vaccination of the Janssen vaccine. Now, this is a very rare but severe event that is associated with administration of various vaccines and medicines. It can also be triggered by the COVID-19 infection itself. But in this case, it has been positively associated with the Janssen vaccine. This is a rare condition, as I've indicated, which leads to paralysis, which can also lead to need for ventilation, which was the case in this particular case. The patient was admitted to hospital, ICU, but unfortunately succumbed to the Guillain-Barré syndrome. Now, the investigations are still continuing to look at other reported cases of severe adverse effects, and the team which is working on this, which reports to SAPRA, will indicate if there are any other situations where such severe effect of vaccination have resulted in severe disability. Now, we'll remember that we did establish the no-fault compensation scheme. So in a case where this causality is established between a severe illness, including death, we have now the full panel, which is looking at all these reports to adjudicate cases which are being referred to the NISEC, which is the team of experts which is looking at all these reports. There are currently 75 cases which have been referred from the NISEC, which will be considered by the adjudication panel, and where causality is confirmed and adverse effects has led to a certain form of disability or severe illness, the no-fault compensation scheme will then kick in. Just lastly, in brief, on the 29th of July up to the 2nd of August, a delegation of South Africans under the auspices of the Ministry of Health and Department and SANAC, which was coordinating, the South African National AIDS Council was coordinating. We attended the International AIDS Conference in Montreal, Canada. Now, this was happening is the first in-person International AIDS Conference since 2018 due to the effect of the pandemic, of the COVID-19 pandemic. Now, so thousands of representatives from governments, from civil society, scientists, researchers, all assembled in Montreal, look at the number of issues in relation to the management and the control of AIDS, HIV. We know that through the United Nations and through UNAIDS, all of us, members of the UN and WHO, have committed to the eradication of AIDS as a public health threat by 2030. And a number of milestones which we have agreed upon. First of which is the 1990, which says that we must have all countries by 2020. So many of us have already missed this because of the COVID, that in all our countries, 90% of people living with HIV must know their status. 90% of those who know their status must be treated, must be on treatment, and 90% of those on treatment must be virally suppressed. The next target is the 95 by 2025. So this conference was looking at this again to see where we are, where the world is in terms of this, and also looking at various interventions. The theme of the conference was that we must recommit, but also we must follow the science. So a number of scientific developments were also on display and reported. Amongst the things which were really countries were urged to do was, amongst others, to implement the pre-exposure prophylaxis for HIV, especially for the population at risk, such as sex workers, but also in terms of young girls and adolescents, those at risk. But also, and there was also a call by a number of participants to also look at new scientific methods, such as the pipeline ring, but also to look at the long-term injectables, which can also be able to make sure that we can have a better control. So on the one side, we're looking at the biomedical side, that all of us must look at the science, but also a number of scientists, including our own scientists. Professor Glenda Gray was one of the presenters, who presented also the progress which is being made in as far as vaccination for HIV and AIDS. Let me leave it there, facilitator, so that our team can also, of experts, can also add on some of these matters. Thank you very much.